Patient abandonment is directly related to professionalism because nurses have a responsibility to make sure patient care continues safely once they accept an assignment. Being a professional nurse means staying with assigned patients until another qualified nurse takes over care, and also communicating with the supervisor if there's a problem with the assignment. According to the California Board of Registered Nursing, abandonment happens when a nurse accepts responsibility for a patient and then leaves without making sure arrangements are in place for another provider to continue care. Following these expectations is part of maintaining accountability and protecting patient safety. As nurses, this is what we agreed to do when entering the profession. Patients depend on us during vulnerable situations, and we cannot simply leave when things become stressful without ensuring their care continues appropriately. There are clear nursing standards under Board of Nursing regulations and the Nurse Practice Act that explains nurses cannot leave patients without proper handoff. In the Miller v. Tennessee case, where a nurse left her assigned patients before the end of her shift without reporting to leadership, the Tennessee Board of Nursing determined that this action met the definition of patient abandonment. This case shows how professionalism includes communication, accountability, and following workplace policies that protect patients. If nurses do not follow abandonment rules, there can be serious consequences for their license. Board of Nursing is responsible for protecting the public and can take disciplinary action when standards are not followed. In the Miller case, the nurse was fined and required to pay a legal cost, and the board also attempted to suspend her license. In general, patient abandonment can result in probation, suspension, or even loss of a nursing license depending on the situation. Understanding these expectations helps nurses protect their licenses while also providing safe and responsible patient care.
System-based practice is a core competency in healthcare that emphasizes understanding how patient care is influenced by broader systems, including institutional policies, legal frameworks, and interdisciplinary communication. The case of Miller v. Tennessee Board of Nursing provides a clear example of how breakdowns within these systems can lead to patient safety concerns and professional discipline. System-based practice requires healthcare professionals to recognize the patient care depends on coordinated systems rather than the isolated actions. Of course, one of the major issues in this case was the communication system, where the nurse she failed to notify the supervisor that she was leaving, which in turn can affect patient safety. Another key system-based issue demonstrated in this case is the failure in the transition system. Safe patient care requires proper handoff when responsibility is transferred from one nurse to another. Same goes for doctors. Miss Miller assumed that the other nurse would take over her patients without telling them to, as well as she failed to give a formal handoff. This represents a system failure that contributed directly to the finding of this patient abandonment case. Lastly, a big part of system-based practice is the collaboration between a team. Effective teamwork is essential, which allows all clinicians to identify system errors and implement solutions for those issues. After researching this case, there was no changes in aspects of system-based practice.
The nurse's role in informatics and technology involves using tools such as the electronic health records, patient monitoring systems, and communication methods like SBAR to document, communicate, and coordinate patient care. These systems are essential for ensuring accurate information is shared, responsibilities are transferred, and care continues safely. Informatics is not just about documentation. It also includes real-time communication and proper handoff to prevent gaps in care. In this case, the nurse documented patient information but failed to use communication and handoff processes. She left her shift without notifying the supervisor or ensuring another nurse assumed care. One patient required fetal heart monitoring, which was not completed or even followed up on. This demonstrates that failure to properly use informatics and technology can lead to breakdowns in communication, gaps in care, increased risk patient harm, and ultimately patient abandonment. Nurses must use these tools effectively to ensure patient safety and continuity of care.
Communication is a fundamental nursing competency that plays a critical role in ensuring patient safety. An important aspect of communication in professional nursing practice is clear, accurate exchange of patient information among healthcare providers. This includes shift report between nurses. When there is a lack of communication, it can lead to gaps in care, which may be interpreted as patient abandonment. Patient abandonment in nursing occurs when a nurse unilaterally terminates the nurse-patient relationship without providing reasonable notice or ensuring a proper transfer of care to another qualified professional. The legal implications of poor communication are highlighted in the case of Miller v. Tennessee Board of Nursing. In this case, a nurse left her assigned patients without ensuring a proper transfer of care or adequate communication with other staff members. As a result, the Board of Nursing took disciplinary action against her license.
Hi, my name is Joshua Tardif, and my role in this project was looking at the relationship between quality improvement and patient abandonment. Patient abandonment is the termination of the patient-provider relationship without reasonable notice or transfer of care to another qualified provider, and quality improvement is a systematic approach to improving the quality of care provided in a healthcare setting. Quality improvement is done through the collection of data and then using said data to formulate quality initiatives that aim to improve the care being provided, as well as to prevent adverse events from occurring. In our case, we looked at a nurse who left the floor due to a non-emergency illness without giving due notice to her supervisor, despite instructions from her charge nurse to do so. Thus, this was termed a case of patient abandonment, as the nurse did not ensure transfer of care, and a gap was created in the care being provided to her patients. The person in charge of quality improvement at this hospital, after investigating this incident, may try implementing a more robust system in regards to reporting an employee leaving the floor. If such an incident were to occur again, that is, a nurse leaving the floor due to a non-emergency illness, the nurse wishing to leave early may still be told to go tell her supervisor, but the charge nurse may also now be required to send a notice to the supervisor in regard to the employee leaving. This would ensure that the continuity of care is not broken for the patients whose nurse is leaving the floor, and if the nurse for whatever reason still chooses not to tell the supervisor that she is leaving, proper disciplinary action can still be taken. Additionally, more education may be provided to employees on how to properly leave the floor without it being considered a case of abandonment. The person in charge of quality improvement at this hospital could try implementing these two new policies, and after some time, they would look at the rates of patient abandonment occurring in the hospital and see if they have diminished or ceased. If so, these new initiatives could be said to be a success and they would remain in place. And if not, new initiatives could be brainstormed and then implemented, and then this cycle of data collection and initiative formulation would continue until incidents of patient abandonment had stopped occurring.
Patient abandonment occurs when a nurse-patient relationship has been established and the nurse discontinues the relationship without transferring care to a qualified professional, putting the patient at risk for harm. Research shows that abandonment is often linked to factors like poor communication, understaffing, and nurse burnout. Studies support that using structured handoff tools like SBAR and bedside report, as well as maintaining safe staffing levels, significantly reduce errors and improve patient outcomes. A bedside report allows the oncoming nurse to establish a patient-nurse relationship, while the outgoing nurse is able to terminate that relationship. As nurses, we use evidence-based practice by always giving a proper handoff, documenting care accurately, and advocating for safe assignments. If an assignment is unsafe, it must be addressed before we accept responsibility. Within facilities, giving appropriate nurse-to-patient ratios is a way to combat patient abandonment, prevent staff burnout and fatigue, and overall improve outcomes for patients. Using evidence-based practice helps to protect our patients, our licenses, and ensure we provide safe, high-quality care.
My topic is patient abandonment, and I am covering teamwork and collaboration. Teamwork and collaboration are vital in preventing patient abandonment. As a team, you work together to make sure your patients are covered, whether it's going on break and making sure another nurse is there to cover your patients, or leaving for the day and making sure that next nurse is there to care for your patients. This nurse in this legal case left without following the proper procedures to make sure that her patients would be covered. She left only telling the nurses that were there that she was going to be leaving because she was sick. And they told her to go talk to management, and she did not do that. She left anyways. If she would have communicated and collaborated with her manager, she could have found a better way and made sure her patients had the coverage and care that they needed in her absence, and this whole case could have been prevented. Teamwork and collaboration are very important. The open communication within a team is needed in preventing patient abandonment.